Welcome to our channel HASHMICLINICS.
All right, hello everyone. Let's get right into it. Today, we're going to take a deep dive into ARISTOLOCHIA milhomens. Now, this is a remedy that's frankly pretty fascinating and I think often gets overlooked in our Materia Medica. So our goal here is to really build a solid, clinically useful picture, something you can take from this session and apply directly in your practice. Okay, so here's our plan. We're going to walk through 5 main sections. We'll start with the introduction and its core essence, then move into the mental and general picture, get into the nitty-gritty of the characteristic particulars, look at modalities and comparisons, and finally, wrap up with clinical application and some key pearls. It's a logical flow to really lock this remedy in. All right, Section 1, Introduction and Central Essence. Let's first identify what this remedy is all about, its core identity, and where it acts. So here are the basics, the remedy's profile. You've got the common name, Brazilian snake root. It's from the ARISTOLOCHIA family, and we get the tincture from the flowers. Now, this last part is really important. It's a predominantly right-sided remedy. Kind of tuck that piece of information away, because it's going to create this really interesting contradiction when we look at one of its key symptoms a bit later on. Okay, if you remember nothing else from today, I want you to remember this. This is the absolute core, the genius of the remedy. It's this unique combination of sharp, stitching, almost electric-like pains, coupled with a really deep-seated fragility in the circulatory system. And here's the kicker. This whole dynamic plays out in 2 very specific, polar opposite places in the body, the apex of the heart and the Achilles tendon. Heart and heel. That's the essence. Okay, let's move on to the patient's inner world, the mental and general picture. We're going to look at the mind, dreams, and physical sensitivities to see how this constitution really shows up in the patient. So when we look at the mental sphere, it's interesting. Most of what we know comes from the dream life. It's incredibly vivid and disturbed. The patient's mind is just busy. Even when they're asleep, they're dreaming about business, having amorous dreams. But then you get these really peculiar themes, like dreams where it's impossible for them to drink or they just can't walk. You see that? It points to this inner state of frustrated effort, this feeling of being powerless. And, you know, that internal disturbance we see in the dreams, it's totally mirrored in their physical state. The sleep is, no surprise, restless, and they wake up feeling like they haven't slept at all. They get this pasty mouth in the morning, zero appetite, but at the same time, they're incredibly thirsty with a bitter taste. And then there's this feeling of a burning hot head. It's a classic picture of internal turmoil, right? Some kind of metabolic dysregulation going on. All right, Section 3, this is where we get to the really good stuff, the guiding symptoms. We're going to locate the remedy's unique expression. These are the particulars that are going to make you say, aha, this has to be it. Okay, first keynote, and this one is a big deal. We're talking about a lancinating pain right at the apex of the heart. Notice how precise that is. This isn't just some general chest pain. It's at the apex, and it's so sharp, so intense that it literally stops their breath. If you see this symptom, your brain should immediately start thinking about this remedy. And here is that polarity I was talking about, a cramp-like pain in the left tendo Achilles. Now, remember what I said earlier. This is a right-sided remedy in general. But here, you have this incredibly specific, strong pain at the total opposite end of the body. And it's on the left side. That kind of contradiction is gold. It's a hallmark of the remedy, a huge confirmation. And this next one, wow, large, irregular patches on the leg, and they're formed by extravasated blood. This just screams circulatory fragility, right? This isn't just, oh, I bruise easily. No, this is different. We're talking about these big, splotchy pools of blood under the skin. If you see this in a case, it's a powerful visual confirmation of that weakness in the vessel walls we talked about. Okay, let's look at the digestive system. There's a really clear pattern of irritation here, and it goes from top to bottom. You might see excoriations like raw patches on the lips and gums. Then, in the stomach and abdomen, a lot of flatulence and rumbling. But the real key here is the sequence. They get this awful colic, this cramping pain, and then it's followed by a diarrheic stool, which brings relief. But that's not the end of it, because that then leaves a burning pain in the anus. It's a whole chain of events. Now, that stitching character of the pain, it's not just in the heart and heel. We see it pop up all over the musculoskeletal system. So you'll get pain in the back, in the limbs, a feeling of stiffness in the legs. And look at the ankles. There's often swelling and itching right around the malleoli. It's a broader picture of that same painful, inflammatory state. Moving on to the urinary and sexual sphere. There's definitely an affinity for the urinary system. The patient often has to urinate more frequently than usual. But here's the really critical clinical note: its connection to diabetes, specifically cases where there's sugar present in the urine. And remember those amorous dreams we talked about? Well, in the sexual sphere, that can manifest physically as a tendency toward pollutions.
All right, Section 4, Modalities and Comparisons. This is all about context. What makes things better or worse? And how do we tell it apart from other similar remedies? Super important for precise prescribing.
The primary modality is incredibly clear and reliable. The aggravation is before stool. That abdominal colic we mentioned, it gets much worse right before they have a bowel movement, and then as soon as they do, there's relief. That before and after is a really strong guide. Okay, let's talk differential diagnosis. It is so easy to confuse Milhomens with its cousin Aristolochia serpentaria. They're in the same family, but they have totally different centers of gravity. For Milhomens, think pain and polarity. It's all about those sharp, stitching pains at the heart apex and the tendo Achilles, plus that circulatory weakness. For Serpentaria, on the other hand, think collapse and gas. It's a picture of profound digestive collapse, crazy bloating, what we call meteorism, and tons of watery diarrhea. So one is pain and polarity, the other is gas and collapse. Big difference.
Okay, last section. Let's bring this all together. Clinical application and pearls. How do we actually use this at the bedside? Let's make it practical. So where should you be thinking about this remedy? Well, here are your main clinical entry points. If a patient comes in with a diagnosis of diabetes mellitus, or complains of Achilles tendonitis or heel pain, or has those angina-like pains, your radar for Milhomens should go up. Same with easy bruising and extravasations. The diagnosis is just the door. The unique symptom picture we've been talking about is the key that opens it. To make it even easier, here's a quick 4-step checklist for your brain. 1. What's the pain character? Is it sharp, stitching, lancinating? Yes? Okay. 2. Is that heart-heel axis present? Pain at the heart apex and the Achilles tendon? Check. 3. Investigate circulatory fragility. Ask them about bruising, look at their legs for those patches. And 4. Is the patient diabetic? Especially in a diabetic case that has these keynotes, you have to seriously consider this remedy. Here's a great prescribing pearl to lock this in. Think of Milhomens when you see this paradox: circulatory weakness combined with intensely sharp vital pains. See the contrast? The weakness is in the vessel walls, the structure, but the pain, the energy, is sharp and vital. That paradox is the signature of this remedy. So I'll leave you with this question to think about. Which of your unresolved cases could this heart-heel remedy be the key for? You know, think about those tough cases, the tricky heel pain, the weird angina-like pains, the diabetic patient that just isn't getting better. Maybe, just maybe, the missing piece of the puzzle is this unique picture we've just walked through.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.